So I think I know most people here. My name is Mary Rabbit and I'm the Research Programme Manager here at the All-Ireland Institute of Hospice and Palliative Care. And today we're delighted because we're going to be launching, and if you look in your pack, you'll see the PCRN strategic plan for 2023-2027. And just to say, this is a really collaborative process. We had a workshop in this room on the 16th of June with 30 of our key stakeholders, clinicians, academics, policymakers, service providers, people with life-limiting conditions and family carers, interested citizens, and just to kind of get input to the plan. And we've gone through the Strategic Scientific Committee, we've consulted widely, and this is the final document, and we've all agreed on this. So just to say, and I think Growth and Morris said it really well, around the ageing population and the thing that people are living longer with serious illness. And so some of our research, and we have our researchers here that have done some of this research, the predicted growth in palliative care on the island is 75% in the Republic of Ireland by 2046 and 31% in Northern Ireland by 2040. So I think it's very pertinent and very good that, you know, now we're trying to launch this plan, and as Andrew said, it's to build more that clinical and academic partnerships and collaborations, and that's what we're going to discuss here today. We'd really like to thank the support and resources that both the HRB, Maura Heine here representing the HRB, Dr. Maura Heine and Dr. Janice Bailey and Dr. Gail Johnson from the Health and Social Care R&D Public Health Agency, also from the HSC and the Departments of Health, because that support is vital to supporting the network. We'd also like to thank all our members of the Institute and how we're all working together and involved to try and look at those predicted growth figures and to try and see how we can provide that palliative care. So I'm just going to talk very briefly, it's all in the plan. I suppose, what did we achieve over the last 5 years? So we did achieve a lot, and now we're looking about as well what we need to do for the next 5 years. And what are our commitments and how are we going to measure the success of it? So in relation to what we've achieved, I suppose one of the biggest things was the increase in PCRN membership. We're up 58%, 53 members now. We included 4 new disciplines: occupational therapy, physiotherapy, speech and hearing therapy, and law. So it's really good. We've 9 disciplines now across the network working together, both clinicians in our hospice and academics in our hospice and palliative care providers and universities. So these are senior researchers. We're also delighted that the Early Career Researcher Forum had a 434% growth in numbers. We're over 215 now, and we have a lot. We're delighted the ECRF is going to be presenting here later, our members, and we have chairs of the ECRF here and former chairs of the ECRF that really helped to promote this. We 10 members of that Early Career Researcher Forum who transitioned to the PCRN membership. That was a really key impact we had. We are very good for all the events we have. We've had 5 symposiums, 2 All-Ireland events. We've had numbers. We've hosted the AIIHPC Public Health Conference. We've had over 1,200 participants at these research events looking at palliative care. We've supported our members to take on leadership roles, and I suppose the most impactful one was Professor Sonia McIlfatrick in the University of Ulster, which we supported. She's now on the board of the European Association of Palliative Care. That's a really key position for palliative care on the island of Ireland. We're delighted as well to have both Voices for Care members from before and new Voices for Care members, because the membership was refreshed, who've been involved in research activities. We had over 90 requests from PCRN and ECRF members and over 85 activities and research studies that Voices for Care members were involved in. Key always is the funding to do the research, and it's really, I suppose, and you'll see it a lot in here, is to support our members to get and attract that funding and secure it so they can secure their career paths, continue to work in palliative care. Between 2017 and 2020, over 3 million was secured from an EU perspective on collaborations, and national funding of over 2.3 million. There's been lots of peer-reviewed publications and everything else. And just to say, there's 8 podcasts, and that is all down to the Early Career Researcher Forum, because they have been leading the way on doing podcasts, and we'd love our senior members to be looking at that too. So the vision is that this network is the leading network in the island of Ireland, and they undertake internationally recognised research, enhances palliative care knowledge, and improves the quality of life for people and death of people with life-limiting conditions, and supports their families. Our mission is to work across the Institute's strategic work programmes as well. So we integrate research, education, practice and policy developments. We partner with users and carers, as we've said, and to target the development of specialist palliative care to meet the current and emerging demands. The values, and we had a good discussion on values when we were coordinating this, and I suppose it was considered that we would keep the values in: research excellence, respect, trust, mutual understanding, equality, diversity, inclusiveness, curiosity, collaboration and integration. So, and I think you're all showing that today. So the priorities for the next 5 years are to strengthen and expand the collaboration that we've built on, create that academic clinical environment to foster innovation. As Andrew said, that is one of the key areas we're looking at as well. Develop our palliative care researchers and support their career paths. Keep involving people with life-limiting conditions, families and carers across the research cycle at all stages. And very importantly is to maximise that research impact on practice and policy. For each of these areas, we have a number of commitments that we have said we do and how we measure success. So by strengthening and expanding collaboration, we're going to work across disciplines on the island of Ireland and internationally, looking at areas of common interest to improve that quality of life and death. One of the key things we're looking at is setting up special interest groups, for example, for children's palliative care, which was mentioned by Maurice and others. We're very important that we measure. How are we going to measure what we do? So it's important that we measure the PCRN-led collaborations that are submitted and that actually attract national and EU funding. And also the PCRN members that are leading roles in EU projects. We're delighted. We're going to have Professor Kevin Brazil here speaking later, who's one of our PCRN members who's leading out on an EU project across 6 countries. So we'd like more of that over the next 5 years. We want to create that academic clinical environment to foster innovation. We want to improve that connection between the multidisciplinary studies and to address those important questions to look at the capability within the clinical areas and how we can come together and support structures. We want to see a 20% increase in health and social care professionals across our member organisations, hospice and palliative care providers involved in palliative care research. We want at least one strategically planned multi-site clinical site intervention study in palliative care, and we're delighted that Andrew is the chair of the PCRN SSC, because I think that's his main aim to get there. And also one of the things we're going to do in this area is set up a community of practice involving the researchers and also involving the health and social care and the clinicians, so we can really focus on it. There's a number of key, and you'll see it in the plan. We want to develop the palliative care researchers and support their career paths, because if we do not have them in areas and that they stay in palliative care, then that will impact on the research. So we want to make sure they can take up leadership roles. We want to increase the early career researchers that are moving and transitioning to the PCRN, and we want to make sure that we get some secure investment and funding for our PhDs and postdoctoral researchers in palliative care. We want to ensure that we involve people with life-limiting conditions and family carers across and communities across the research cycle. We're also going to look at co-creating an evaluation framework to evaluate the impact, because if we can evaluate the impact of PPI, public and patient, or personal and patient involvement in research, this will really help to copper fasten it with everybody. I know our funders are really promoting it and our researchers are really trying to increase it, but when you measure it, then they can see the impact. So we want to increase the number of voices for care members involved in it, and we want case studies to look at that evaluation impact. And then finally, and most importantly, is to maximise the research impact on practice and policy. We want to make sure that that research evidence is really, if you like, you're going to look at it from every single angle. So we want to work with the policymakers, which we have here today. We want to work with service providers and clinicians, and we want to make sure that we can have case studies looking at implementation and impact. We want to look at policy briefs and practice briefs, and that we co-create them from the research. And we want to keep having that peer-reviewed journal articles as well as other things. And I suppose it's very important that we include our policymakers and our social care professionals and service providers at activities and events. So sorry, it's a bit of a whistle-stop tour. I was trying to keep it within the time. It's all in here, and we're just so delighted to have you here today and to launch the plan. So, and any questions at any time, let us know. And just like to thank everybody here for involvement, and also my colleagues, Claude O'Donovan, Dr. Emer Brangan on the research team, Karen, and all the institute.